Assalamu alaikum. Welcome to my channel IRTAZA KAZMI. My name is Syed Irtaza Amir Hassan Kazmi and I am an orthotist prosthetist. You are watching the first episode of Orthotic Series. This educational video series is all about orthotics, its clinical and technical aspects. Through these videos, I will try to share information, knowledge and experience which are beneficial for the health professionals in general and rehab professionals in particular, especially the students of physiotherapy, occupational therapy and orthotics and prosthetics. In this video, we will discuss about orthotics, orthosis and orthotist, terminology, factors in prescription, indications, expected outcomes, effects, associated issues of using orthosis, design characteristics of orthosis, and common disadvantages. So, when we talk about external sports or the orthotics, one can think about many options and get confused. Over the years, these terminologies like orthotics, orthosis, orthotist are not so common and familiar. Yes, one can relate and guess from the word ortho that this has some link with orthopedics, but still this can be confusing to anyone, so we will start from the basic terminologies. Orthosis, an externally applied device used to modify the structural and functional characteristics of neuromuscular and skeletal system. Orthotics, the science and art involved in treating patients by the use of an orthosis. Orthotist, a qualified professional having completed an approved course of education and training to clinically assess and prescribe the design, measure and fit orthosis. Other than the orthosis, you must have heard name braces, corset, splint and calipers. And I'm sure you will find these terms sound familiar because for a long time these terms were very commonly used among the medical professionals. These braces are identified by proper names or eponym derived from the place of origin, the developer, or sometimes a name unrelated to either. A similar plethora of names is used for braces applied to other parts of the body. These eponyms frequently don't give the site of application and often give no indication of the function provided. Two braces ordered by one eponym from two suppliers may result in two braces which are significantly different not only from each other but also from the description of the original developer, because the terminology is illogical and the use of these named braces can only be learned by understanding. So one can easily be confused. These are the definitions of terms. Braces, a device fitted to something, in particular a weak or injured part of the body, to give support. The corset, a tightly fitting laced or stiffened outer body, started in 18th century from a Latin word corpus. Splint is derived from a German word mean a strip of rigid material used for supporting and immobilizing a broken bone. Calipers, started from 16th century, means a metal support for a person's leg. Due to this situation, international terminology standards were developed. In international terminology standards, orthosis is described by the joint they encompassed. If the foot bones are involved, the orthosis will be named as foot orthosis. If ankle and foot is involved, we will name it as ankle foot orthosis. If knee, ankle and foot is involved, the orthosis will be knee, ankle, foot orthosis. And if hip, knee, ankle, foot is involved, it will be hip, knee, ankle, foot orthosis. If only knee is involved, then it will be knee orthosis. Only hip is involved, then it will be hip orthosis. Similarly, for upper limb, it will be hand orthosis, wrist hand orthosis, elbow orthosis, shoulder orthosis. And if we go for spine, then it will be sacral orthosis, lumbosacral orthosis, thoraco-lumbosacral orthosis, and cervico-thoraco-lumbosacral orthosis. For cervical region, or we call cervical orthosis or collars. For cranium, the cranial remolding orthosis is commonly used. Factors in prescription. Factor in prescription is based on the objectives. There are two objectives. One is clinical and second is functional. In clinical, to relieve pain, to prevent an excessive range of joint motion, to compensate for the abnormalities of segment length or shape, to increase the range of joint motion, to manage deformities, to protect tissues and to promote healing. While for the functional objectives, to prevent, reduce or stabilize the deformity, to modify the range of motion, to add the length or alter the shape of a segment, to compensate for weak or to control hyperactive muscle, to reduce or redistribute the load on tissues. Indications: to relieve pain, to limit motion, to correct deformity, to immobilize after surgery, to immobilize after traumatic injury, to relieve by supporting or assisting neuromuscular system, to reduce axial loading by mechanical unloading, to improve certain movements, and to treat fractures. Expected outcomes: assist and improve movement and function, protect against further injury, provides protection against further progression, provide stability, provide correction, and provide rest. Commonly asked question is duration of use, determined by the individual situation, that based on purpose to use the orthosis, expected outcomes, severity of deformity, and physical condition of the patient. Effects: decrease pain, increase strength, improve function, assist healing, improve posture, protect against instability, minimize complications, and increase proprioception. Associated issues of the use of an orthotic device. There are so many. Discomfort, local pain, skin breakdown, nerve compression, muscle atrophy with prolonged use, difficulty in donning and doffing, difficulty with transfers, possible increase in energy expenditure with ambulation, psychological and physical dependency, and poor patient compliance. Design characteristics: cosmesis, cost, functional use, adjustability, durability, and materials. Design characteristics of an orthotic device also based on the ability to fit various sizes of the patients. This is in the case of prefabricated orthosis. Ease of putting on or taking off, that is donning and doffing. Access to surgical sites for wound care, or to tubes or other drainings in case of a fracture or post-surgical orthosis. Aeration to avoid the issues. So, with these design characteristics, the function without dysfunction is considered. Improve function, save energy, and increase endurance. Commonly observed disadvantages and limitations: limit mobility and range of motion of the joint. Movement is usually restricted to certain direction. Weight of the orthosis, that is based on the materials and the components used. The device is exposing to wear and tear that needs maintenance, care, cleaning and repairing, and sometime replacement. Please give your feedback, comment and subscribe to the channel.